with you, it's we've often thought, you know, Ben said it, there is anybody who really doesn't agree with having free parking for the NHS, but you are one of those people who thinks it doesn't necessarily need to continue and people shouldn't necessarily feel insulted by that perk being taken away.
I don't think that is what I've said. Actually, what NHS providers who represent hospital trusts and other types of healthcare organisation up and down the country has said is that actually during this pandemic, it's absolutely critical that NHS staff are able to park for free. We know that it's really important that staff can get to work and park easily. I think that the issue here is remembering that the pandemic isn't yet over. And so all while the pandemic is there, we need to see staff able to get to work safely. We know that people are being asked not to make unnecessary journeys in public transport. Therefore, we think that the government should continue to fund free parking for hospital staff for the duration of the pandemic. And at the moment, we don't know how long that pandemic's going to go on for.
The tricky thing, I think, for people this morning, Saffron, and we'll come to Basha in just a second, I'm sure we can confirm this, is I don't understand why, whether there's a pandemic or not, offering this to our NHS staff isn't a hugely important perk, and they're helping them get to work and helping them park, because their job is no less important whether there's a pandemic going or not. They are still hugely key to all of our health and our safety. And I don't know why, and this is what everybody's struggling with, why this should be the case, why they should have to pay to go to work. Surely that would be a wonderful incentive for us to say, thank you for all the hard work you do, thank you for keeping us safe, thank you for looking after us.
Absolutely, and I agree with that. And I think the imperative thing is that the government brings in the funding to enable hospital trusts and other trusts to do that. What we do have to remember is that the upkeep of hospital car parks comes out of hospitals' budgets. Therefore, if hospitals have to pay for that upkeep, they need to get an income in order to pay for that upkeep. If they don't, that gets taken away from patient care. And this is the really difficult balance that we've got to remember is if we want to get rid of car parking charges, then the government has to fund that. So if everybody wants to see car parking charges for hospital staff removed, then the government needs to fund that, because at the moment hospitals are responsible for the maintenance and the overall management of their car parks, and they really need to see that income replaced.
Basha, what do you make of it? What has it meant to you and others, colleagues, to have this moment of sort of relief, if you like, that when you're parking, you can just get out the car and get into your job and not have to scrabble around for change and whatever? And just the principle of it about being appreciated in that way. What difference has it made?
It's so ironic that it's taken us a pandemic to realise the value of healthcare workers. I wonder, the people making the rules, have they ever worked on the front line? Have they ever been on a night shift on their feet for 12 hours like our nurses to know what it really takes? That it's not just about money. And if we're talking about patient care is also the carers, the people who are providing the care. And if we don't feel cared, we cannot provide the care. A part of the feeling valued was the car parking fees being taken off. And this returning with the pandemic being eased just makes us feel that, oh, we're back to square one. We're not appreciated for all the strokes, the heart attacks, the kidney failures that we look after. It's exactly what you said. And if we're talking about budgeting and worrying about where to get the money from, then I should say that we should think about preventative medicine rather than curative, and think about how we can keep people away from hospitals in terms of patients should be kept well in the community, and we should think about that rather than trying to cut costs from staff facilities like the car parks.
OK, let's get Dr Hillary's thoughts on this as well, because I'm sure you've got an opinion, Hills.
No, absolutely. I was listening to the CEO there of NHS providers, and she makes the point that if we don't charge for the car parks, the patient care resources will suffer. But actually, it seems that they want it both ways, because I worked at Basingstoke and I know that it's got a massive car park, which is very difficult to park in and is very expensive. They do fantastic work in the hospital. But they sold off a massive plot of land there with about 30 or 40 blocks of buildings a few years ago, and all of that money went into commercial sales. It wasn't ploughed back into the NHS. So why didn't that money go into patient care and patient resources? And how many car parks are now privately owned so that the money they earn doesn't go into the NHS, it goes to private providers? I can also ask the question, do management get free parking to NHS hospitals, or is it just the doctors and nurses who have to fork out from their meagre salaries?
OK, well, let's put that to Saffron Cordery. What would you like to say?
I think, well, first I want to pick up on the point that Basha made, which is what we are talking about here is actually about the adequate funding of the NHS overall. So this is about making sure there is the right level of income for hospital trusts and other trusts. It's about making sure that we invest in prevention so fewer people need to turn up at hospital sites in the first place. So I think that's really, really important to say. Obviously, I'm not going to comment on what goes on in individual hospital trusts and their the decisions that Basingstoke made about its land. That's very much for Basingstoke to make that decision. I think what I would say...
Does senior management have to pay for their parking?
I don't know. I don't know that situation in Basingstoke. I don't know if that's the case. I think what I would say is that we have to remember how expensive it is to run and maintain car parks. I'm not sure if people realise that to build a car park costs £5,000 a space, and to maintain a car park costs anywhere between £500 and £1,000 per space per year. This is a huge expense, and car parks need to be kept well maintained, they need to be safe, they need to be well lit. And when car parks are in city centre sites, if they are free, we have found, and this is trust experience up and down the country, that the parking gets taken by those wishing to go to the shops to access other services and not the hospitals. So we need to see investment in NHS trusts so that they can offer free car parking to their staff. And we need to see capital investment in the technology that enables things like number plate recognition so that we can offer the free parking to people who are regular users of hospitals and to staff.
Let's put those points to Pasha, because clearly it is an expensive thing. You want to have a car park that's near to the hospital. You want to be able to park there safely because, as you say, you're doing long night shifts. You want to be able to get to your car quickly if you can. That upkeep and that money has to come from somewhere, Pasha.
I totally understand, and we have a fantastic healthcare service. It's rated #1 in so many levels, our NHS. But unfortunately, that is just for patient care, and I understand that a lot of the upkeep is very expensive. But we have to understand also that we've got very, evidence that doctors are leaving. Only 40% of junior doctors like myself carried on with the NHS last year, and 43,000 nursing spaces in terms of job spaces were filled last year. What does this tell you? This tells us that they're not very happy with the value that is being put on us. If you are talking about having some kind of number plate recognition, I don't think that's a very good way to do it. Why don't we have our NHS cards as a way to get in? If we're trying to stop people from, normal residents around the area from entering the car park. And as I say, in terms of the budgeting, I don't know money-wise, but I do understand that during this pandemic, that we had the perks like the free meals, like the free car parking. The ambience in the hospital was just so much more pleasant. There was so much more morale. And that is so important and key to patient care as well. And I don't understand why people don't see that the staff also need to be happy. And this is important in patient care as well.
Undoubtedly. I've just done a search for this, Saffron Cordery, and it says, just a Google search on the amount of money that was made by hospital parking last year. 2018, 2019, it was £254,373,068. That's up 10% on the record high from the previous year. Now, we know these things are expensive. We know they need to be maintained carefully. But money is being made by the people that are running these car parks. As Hilary said, my local hospital to me is run by an NCP franchise. I don't know whether they lease it off the hospital, but money is still being made. And the frustration for all of our viewers, and I know that probably isn't your personal view and you have to represent the company that you represent, but the frustration is people like Pasha, people like Dr. Hilary, they are saving lives. They are caring for our friends and our family members, and the idea that they're being penalised to pay to go to their work is a really distasteful thing, particularly now, but beyond the pandemic, they should be looked after.
I don't disagree with that. I think what we've got to see is the government bringing forward the funding to make sure that hospital trusts can afford to do this.
But there's hundreds of millions of pounds being made. There's hundreds of millions of pounds being made already. The government will say you have to manage your own car parking. If you give it off to NCP or one of the big car park companies, then take that money and allow the staff to use that parking for free.
The government made a commitment in its manifesto to fund free car parking for a certain number of groups. We have said that they need to make sure that they honour that commitment and that they make sure that hospital trusts receive that money. There's no sign of that yet. What we also need to make sure is that we are looking after our staff effectively. And to do that, everyone appreciates what staff have done in the pandemic. And we want that appreciation to continue. That costs hospital trusts money, and we need that financial support in order to bed these really good improvements in staff working conditions, in order to help them to support patients who need our care.